Unit second, drug acting on autonomic nervous system. Unit second, drug acting on autonomic nervous system. इसमें सिलेबस में है चैप्टर 5 इंट्रोडक्शन टू ऑटोनॉमिक नर्वस सिस्टम, चैप्टर सेकेंड न्यूरोहॉर्मोनल ट्रांसमिशन फार्माकोलॉजी ऑफ न्यूरोट्रांसमीटर, चैप्टर 3 कोलिनर्जिक न्यूरोट्रांसमिशन, चैप्टर 4 कोलिनर्जिक ड्रग, choline receptor agonist or parasympathomimetics. Chapter 5 anticholinergic drug, choline receptor antagonist or parasympatholytics. Chapter 6 adrenergic neurotransmission. Chapter 7 adrenergic drug, adrenoreceptor agonist or sympathomimetics. Chapter 8 anti-adrenergic drug, adrenoreceptor antagonist or sympatholytics. Chapter 9 drug acting on autonomic ganglia. Chapter 10 autocoid histamine analogous and antihistaminic agent 5-hydroxytryptamine and its agonist and antagonist icosanoid platelet activating factor agonist bradykinin and calidin. Chapter 1 Introduction to Autonomic Nervous System. Chapter 1 Introduction to Autonomic Nervous System. Introduction to the autonomic nervous system. Nervous system, two type: central nervous system, brain plus spinal cord; peripheral nervous system, peripheral somatic nervous system, only skeletal muscle; autonomic nervous system or involuntary nervous system, visceral nervous system or vegetative nervous system, viscera, heart, blood vessels, smooth muscle, cardiac muscle, gland etc. ये टू टाइप का है: सिंपैथिक नर्वस सिस्टम, एड्रेनर्जिक नर्वस सिस्टम, पैरासिम्पैथिक नर्वस सिस्टम, कोलिनर्जिक नर्वस सिस्टम. Terminology: afferent sensory nerve to that convey follow the impulse from peripheral to CNS. Efferent motor nerve that convey impulses from the brain and spinal cord CNS to muscles, gland and other effector organ. Ganglion: it is an aggregation of synapses. Neuroeffector junction: the junction of a postganglionic axonal terminal with its effector cell is termed a neuroeffector junction. Nerve plexus: it is a network of nervous fiber. Autonomic nervous system ANS is a peripheral complex of nervous plexus and ganglia that are organized to modulate the involuntary activity of the secretory gland, smooth muscle and visceral organ. This system functions to sustain homeostatic condition during period of reduced physical and emotional activity, and equally important to assist in internal bodily reaction to stressful circumstance. Nerves transmit their impulses across most synapses and neuroeffector junction by means of a specific chemical called as neurohormonal transmitter or simply neurotransmitters. The autonomic drug exert their action on smooth muscle, cardiac muscle, gland, and visceral organ by mimicking or modifying the action of neurotransmitter released by autonomic fiber either at ganglia or at effector cell. Difference between autonomic and somatic nervous system. Difference between autonomic and somatic nervous system. Autonomic nervous system, somatic nervous system. Efferent nerve of ANS supply all intermediate structure of the body except skeletal muscle. They supply skeletal muscle. The most distal synaptic junction in ANS occurs in ganglia that are entirely outside the cerebrospinal axis. Somatic nervous content no peripheral ganglia and synapses are located entirely within the cerebrospinal axis. Many autonomic fibers from extensive peripheral plexus. No peripheral plexus is present in somatic nerve fiber. When cut, organ supplied generally show some level of spontaneous activity independent of intact innervation. When cut is skeletal muscle supplied become paralyzed and undergo atrophy. Preganglionic and postganglionic fiber are present. No such nomenclature. Postganglionic autonomic nervous fiber are generally non-myelinated, slow conduction of impulse, whereas preganglionic fiber are myelinated, fast conduction of nerve impulse. Most fiber of skeletal muscle are myelinated. Difference between sympathetic and parasympathetic nervous system. Difference between sympathetic and parasympathetic nervous system. Sympathetic nervous system, adrenergic nervous system. Parasympathetic nervous system, cholinergic nervous system. It arises at thoracolumbar outflow T1 to L3. It arises a craniosacral outflow with third oculomotor, 7th facial, 9th glossopharyngeal, 10th vagus, and 11th spinal accessory cranial nerve, along with 2nd, 3rd, and 4th sacral nerve. Ganglia are nearer to the CNS. The ratio of pre and post ganglionic fiber is generally 120 or more, so the post ganglionic fiber is longer. Ganglia are away from the CNS and on or close to the organ. The ratio is generally 1 is to 1, so the postganglion fiber is shorter. Exception in Orbeck plexus, the ratio is 1,8,000. Distributed to effector organs throughout the body. Distribution is much more limited. Neurotransmitters are acetylcholine in ganglia and norepinephrine at neuroeffector junction. Neurotransmitter is acetylcholine in both ganglia and at neuroeffector junction. Function of sympathetic nervous system. Function of sympathetic nervous system. As a generalization, it can be said that activation of the sympathetic changes function in a direction which fit the body for a period of activity and energy expenditure. The, for example, blood pressure increase, blood flow is diverted from skin and gut to the CNS and muscles. Bronchioles dilated and glycogenolysis and lipolysis relieve mobilization of energy reserve. Function of parasympathetic nervous system. Conversely, parasympathetic activity modulated body function toward the needs of a period of inactivity and repair of energy deficit. Vital functions are slowed, energy consumption is reduced, and increased digestive function replenishes the stores and evacuates wastage. Sympathetic activity increase in stress and emergency. Parasympathetic activity predominated during rest. Sympathetic nervous system is responsible for providing continuous stimulus to the organ and the part supply. The parasympathetic nervous system is endowed with the modulatory function. If nerve is cut, the animal will survive with some physiochemical changes. If taken out, the function is usually normal, but due to conservation of energy, animal will not survive long. Table: typical responses of effector tissue to sympathetic and parasympathetic nerve impulse. Typical response of effector tissue to sympathetic and parasympathetic nerve impulse. Effector tissue: sympathetic mediated response, parasympathetic mediated response, heart synode, general excitation, general inhibition. Beta 1 increase the heart rate, decrease heart rate. Atria B1 increase contractile force, conduction velocity, decrease contractile force. AV node beta 1 increase automaticity, conduction velocity, decrease conduction velocity. AV block. His Purkinje system ventricles beta 1 increase automaticity, conduction velocity. Beta 1 increase contractile force, conduction velocity. Irritability, decrease contractile force. Blood vessels: coronary alpha 1 contraction, beta 2 dilation, dilation 6, contraction 6. Cutaneous muscle alpha 1 contraction, dilation. Cerebral alpha 1 contraction, beta dilation, dilation. Skeletal muscle contraction, dilation, जबकि इसमें डायलेशन. स्प्लेनिक अल्फा 1 contraction, dilation, dilation. Renal genital constriction, dilation, dilation. Veins contraction, endothelial contraction, dilation, dilation. GI tract smooth muscle beta 1 relaxation, alpha relaxation, general excitation, increase motility and tone. Sphincter alpha 1 contraction, relaxation, secretion decrease, usually increase. Gallbladder relaxation, contraction. Bronchioles smooth muscle beta 2 relaxation, contraction, stimulation. Eye radial muscle iris, sphincter muscle iris, ciliary muscle alpha 1 contraction, mydriasis, beta relaxation for vision. Contraction myosis, contraction near vision. Urinary bladder fundus beta 1 relaxation, contraction. Trigone sphincter contraction, relaxation. Splenic capsule contraction, relaxation. Sweat gland secretion, cholinergic beta 2 secretion hordes. Salivary gland scant, viscous secretion, profuse watery secretion. Below erector muscles alpha contraction, kidney renin release, alpha 2 decrease, beta 1 increase. Uterus alpha 1 contraction, beta relaxation, non-pregnant, more than pregnant, contraction. Genitalia male and female alpha ejaculation, erection, adrenal medulla, secretion of epinephrine, norepinephrine, cholinergic. Autonomic ganglia, ganglionic discharge, cholinergic, ganglionic discharge. Liver beta 2 glycogenolysis and gluconeogenesis, alpha in some species. Pancreas isolate cell acini, alpha 2 decreases, beta 2 increase secretion, alpha decreases secretion, increase secretion. Fat cell beta lipolysis, adrenergic nerve terminalis, alpha 2 decrease release of norepinephrine, beta increase release of norepinephrine, platelet alpha 2 aggregation. Note: superscript number are defined as follow: alpha and beta designated the principal adrenal types of tissue response. Type of autonomic fiber. Type of autonomic fiber: sympathetic fiber, sympathetic adrenergic, sympathetic cholinergic, sympathetic splenic cholinergic or sympathetic preganglionic fiber, parasympathetic fiber, Central autonomic connection. Central autonomic connection. There is no any exclusive autonomic area in the CNS. Considerable intermixing and integration of somatic and autonomic innervation occurs. The highest seat regulating autonomic function is in hypothalamus. Posterior and lateral nuclei are primary sympathetic, while anterior and medial nuclei are primary parasympathetic. Many autonomic centers, pupillary, vagal, respiratory, are located in the midbrain and medulla in relation to the cranial nerve. The lateral column in the thoracic spinal cord contains cells which give rise to the sympathetic outflow. General functions of the autonomic nervous system. General function of the autonomic nervous system. General function of the autonomic nervous system. The integrating action of the autonomic nervous system is of vital importance of the well-being of the organism. In general, the autonomic nervous system regulates the activities of the structure that are not under voluntary control and that functions below the level of consciousness. Thus, respiratory, circulation, digestion, body temperature, metabolism, sweating, and the secretion of certain endocrine glands are regulated in part or entirely by the autonomic nervous system. The consistency of internal environment of the organism is to a large extent controlled by the vegetative or autonomic nervous system. The sympathetic system and its associated adrenal medulla are not essential to life in a controlled environment. Under circumstances of stress, however, the lack of sympathoadrenal functions become evident. Body temperature cannot be regulated when environmental temperature varies. The concentration of glucose in blood does not rise in response to urgent need. Compensatory vascular response to hemorrhages, oxygen deprivation, excitement, and exercise are lacking. Resistance to fatigue is lessened. Sympathetic components of instinctive reactions to the external environment are lost, and other serious deficiencies in the protective forces of the body are discernible. The sympathetic system normally is continuously active. The degree of activity varies from moment to moment and from organ to organ. In this manner, adjustment to a consistently changing environment are accomplished. The sympathoadrenal system also can discharge as a unit. This occurs particularly during range and freight when sympathetically inverted structure over the entire body are affected simultaneously. Heart rate is accelerated, blood pressure rise, red blood cells are poured into the circulation from the spleen. In certain species, blood flow is shifted from the skin and splenic region to the skeletal muscle. Blood glucose rise, the bronchioles and pupil dilate, and on the whole, the organism is better prepared for fight or flight. Many of these effects result primarily from or are reinforced by the action of epinephrine secreted by adrenal medulla. In addition, signals are received in higher brain centers or to facilitate a purposeful response or to imprint the event in memory. The parasympathetic system is organized mainly for discrete and localized discharge, although it is concerned primarily with conservation of energy and maintenance of organ function during period of minimal activity. It is elimination is not compatible with life. Secreting the vagus, for example, soon give rise to pulmonary infections because of the inability of cilia to remove irritant substance from the respiratory tract. The parasympathetic slow the heart rate, lower the blood pressure, stimulate GI movement and secretion, aid absorption of nutrient, protect the retina from excessive light, and impedes the urinary bladder and rectum. Many parasympathetic responses are rapid and reflexive in nature. Thank you.